What's really unique about the Northwell Health Cancer Institute is that we're part of an integrated healthcare system which allows us to provide the entire range and scope of services. So we can care from patients through their entire journey, from screening and diagnosis all the way through treatment and ultimately onto survivorship, where they're followed for the rest of their lives. Our goal is to really provide comprehensive cancer care. Our standard of care should be to provide comprehensive medical care. We want to provide patients with all aspects of their treatment. We want to avail them of the latest and best screening procedures, diagnostic tests. We want to dramatically expand our portfolio of cancer clinical trials to bring the latest cutting-edge treatments to patients. We are extremely proud of our incredible stem cell and cellular therapy programs. One of the things that we're most excited about is we'll be one of the first institutions on Long Island to actually provide CAR T-cell therapy for patients with refractory leukemia and lymphoma.
As the director of the stem cell transplant program, I oversee all aspects of the process. So we do offer our patients a continuum of care where we are collecting the cells, we are processing the cells, and we are also doing the transplants. Patients with relapsed lymphoma or with leukemia, they are able to get their initial treatments and then move on to the process of stem cell transplantation.
The role of the Northwell Health Adult HPC Transplant Program in the health system is that it's the only program in the health system that offers stem cell transplant to our patients. This is a vital service that is offered to patients who live in Brooklyn, Queens, and Long Island. And there's 3 components to the program. There is the pre-transplant workup that happens at the Monti Cancer Center. There's the inpatient stay where the patient actually receives their stem cell transplant. And then there's outpatient follow-up back at the Monti Cancer Center after the patient's discharged.
Every day it is a gift to have the opportunity to care for patients who are in their most vulnerable times, to be able to be a part of the continuum of care for these patients, and to be able to provide expertise and specialized knowledge and treatment that can offer the best chance for cure for these patients.
Some of the strengths of our program is that it's a very individualized point of care for our patients. We do everything we can to make the patients know that we care about them. We know a lot about them. We know about their birthdays. We know about their children's names. We do everything we can to personalize the care.
And we really function almost like an extended family, and our patients then become part of that family, and our extended family is ever growing.
My name is Greg Holgerson. I'm 45 years old. I live in Bohemia, New York, and I'm married to my wife, Christine, and I have 2 kids, my daughter Fiona, who's 9, and my son JT, who's 6. I'm currently a police officer with the Nassau County Police Department, and I've been with them coming up on 19 years. When I had first got diagnosed, due to my age and health, they decided to try and treat me with chemotherapy over the course of a year. So about every 2 months I came in for 5 days of treatment. I had gone back to work, everything was fine. I went in for one more bone marrow test, and that's when I got the phone call that I had come back. I knew that I had to have the bone marrow transplant. Out of the blue, they found a donor on a registry in England that was a perfect match, perfect health and everything, and that's how it started. All I knew that it was a female and that she was from England. I knew nothing else. Through the 2 years, we exchanged cards, but when I finally got permission to, we then got her email address and phone number, and then we started talking all the time. Then when the Monti Center and everybody brought her over to finally meet her in person, it was unbelievable. She's an awesome woman. So I'm 5 years post-transplant. Overall, my health is good, and I just take it one day at a time.
The Don Monti Memorial Research Foundation has supported the stem cell transplant program from the beginning, and I do not believe that we would be as successful as we are without the help of Caroline Monti Saladino.
Caroline Monti Saladino and her family have decades-long commitment to caring for our patients and caring for the staff. They took the tragedy of their son dying at a very young age and turned it into something very positive. Caroline's parents had a legacy that they'd handed on to her where they wanted to have a human touch along with the cancer diagnosis. Caroline rounds on our patients and meets with them, speaks with them. She supports our programs for our patients, which is quarterly parties that we have where we celebrate St. Patrick's Day, and Christmas, and 4th of July, and Halloween, so that patients know there is life beyond these walls here, that there are things to look forward to.
The Northwell Health Cancer Institute is not a single facility. It's a system of 23 hospitals. We need to make sure that in the hospitals that are providing cancer care, which many of them do, that we're standardizing that care, that we're providing the best care possible in all of those locations, and that we're also availing patients of the latest cutting-edge clinical trials in all of those facilities.
I am a believer in transplant democracy. I believe that we need to provide equal access and outcomes for all. And at the end of the day, I do believe that everybody receives a beautiful reward.